When patients picture immediate load implants, they imagine brand new teeth in a day, and they worry that those teeth won't last. But here's what's really happening under the surface. We aren't just placing implants randomly, we anchor them into dense, strategic zones of your jawbone to achieve what we call primary stability. By splinting these implants together with a rigid, custom designed temporary bridge, we completely distribute the biting forces evenly. It locks everything into place immediately, which is exactly why it is stable enough for you to head home and enjoy a meal the very same day. Most people don't realize that immediate load success isn't about luck or speed. It's about planning. When I'm looking at that 3D scan the week before your surgery, I'm reviewing a perfect digital blueprint of your jawbone down to the exact millimeter. This advanced CBCT imaging allows me to map out your precise bone density and navigate around vital structures before the procedure even begins. Because we've simulated the entire surgery digitally beforehand, the implants achieve optimal mechanical stability the second they are placed, completely removing any guesswork. A lot of people think their age is against them when it comes to implants, but bone quality and implant success aren't about how many birthdays you've had. In fact, many 65-year-olds have excellent dense jawbone quality perfectly suited for dental implants. What truly makes the difference isn't age, it's overall systemic health, proper blood flow, and the precise mechanical stability we achieve during placement. By tilting the implant strategically into your existing bone, we maximize support and trigger the body's natural integration process beautifully, no matter your age. The day you leave my office with your new teeth, the real work begins. Not for you, but for your jaw. Let me explain what's happening under the surface. Right now, your jawbone is in a critical transition phase where it is actively growing new bone cells around the implant, a process called osseointegration. To protect this foundation, patients need to stick strictly to a soft diet for those first few months and avoid heavy localized chewing. Keeping the area clean and following our seamless post op routine ensures those implants stay completely locked in place for the long haul. When I design an all on X case, I'm not just thinking about today, I'm thinking about 10 years from now. And that starts with a conversation with my lab team about absolute structural synergy. Partnering with a world class digital lab allows us to sync our clinical data seamlessly. Together, we use premium, resilient materials engineered to withstand your bite force perfectly. This advanced collaboration ensures that your final prosthetic isn't just beautifully customized to match your face, but structurally sound enough to last a lifetime. When patients sit down in my consultation chair, they've usually been afraid of losing their teeth for years. By the time they leave, they understand why immediate load works. Here's how I walk them through it. I show them that we aren't rushing the process. We are simply compressing the timeline using ultra precise, science based protocols. Because we utilize comprehensive 3D data and advanced biomechanics, we convert an unpredictable dental crisis into a highly controlled, step by step transformation that gives you immediate peace of mind. A lot of practices are still using traditional impressions for implant cases, but when I see a patient's 3D anatomy in perfect detail before surgery, I'm essentially running a simulation in my head. In those critical first 24 hours, micro movements can jeopardize how an implant fuses to the bone. Older impression techniques allow for subtle distortions, but our advanced photogrammetry captures the exact positions of your implants with absolute digital accuracy. Those micron level precision ensures the bridge fits entirely passive, keeping the implants completely unstressed and stable right out of the gate. I have a lot of patients who come in and say, Dr. Van Dyke, isn't this too much for me at my age? And my answer might surprise them. Living with a loose, shifting denture that limits what you can eat and causes constant sore spots is actually far harder on your body over time. All-on-X treatment isn't aggressive. It's a highly controlled, life-changing solution that restores your natural chewing power and stops bone loss. You deserve to enjoy your retirement, your favorite meals, your active lifestyle on Marco Island without constantly worrying about your teeth.